Hello friend, welcome to the channel Pharmacy Dictionary. In today's topic we have to continue our systemic route of drug administration, and under that topic today we are going to study about the inhalational and nasal route of drug administration along with their advantage and few limitations. So first of all we have to understand what is the meaning of inhalational or nasal and what are the basic important of this route of drug administration. Unlike the oral route of drug administration, that drug will reach to the systemic circulation, but there is chances of their degradation via first pass metabolism and along with different kinds of acid secretion and food material which are already present in our stomach. But in this case of inhalation route of drug administration, that drug in the form of liquid or gases that will directly reach to the lungs, and from the lungs there are so many alveoli, and in alveoli there are so many blood vessels. From that they will be absorbed very faster as compared to the oral route of drug administration without going for first pass metabolism, without destruction by different kinds of acid and food which are not already present inside the lungs, because that is not possible actually. So this will give our fast effect, this will give our immediate response, as we can say in case of inhalation or nasal route of drug administration. There are so many drugs which we have used. These are general, moderate or most important categorized or specialized drug. Like first of all we have used this Vicks inhaler. This is example of nasal drug, that like we inhale this kind of inhalation to relieve the problem of nasal decongestion. What are the basic constituent of this Vicks inhaler? All are volatile oil in maximum proportion. So these volatile liquids, these are liquids but get volatile. So in this case of nasal or inhalation route, the most important criteria for the drug is that should be mostly preferably either volatile liquid or gases, so that they may get introduced via nasal or inhalation route of drug administration. And the second one, that this says the lungs provide large surface area for the absorption of drug. In our lungs, if you see the anatomy and physiology of lungs in first second semester, then you should know the lungs is composed of so many alveoli. And what are the alveoli? Alveoli are small air sacs which absorb the air, which absorb the volatile liquid, like we are taking inhalation. So whatever we are inhaling, that will goes through the lungs, and from the lungs that will be get absorbed via the different number of alveoli. So I can explain you what is happening inside the lungs. So this is a piece of sponge. This is a piece of sponge. Like I will push this sponge, that will absorb air and will release the air. So these are small units, these are the small cells of this sponge. But as we can assume this as a lung, so there are so many alveoli. Whenever we are taking any gases with the form of inhaler or with the form of autoholer, then that will be absorbed by these lungs, different lungs. So this process is continuously. So under these lungs there are so many alveoli, and this alveoli transfer that particular drug towards the systemic circulation, that means blood. That is why its effect is very fast. Let me give you another example. Whenever any person smokes, this is not correct example, I am not forcing you to do this, but this is unmarked condition. If any person smokes a cigarette, the smoke with containing nicotine, that will directly reach to its lungs, that leads to the lungs, and from lungs it will go through systemic circulation. That immediately he or she feel different kinds of activity in her mind or his mind. So this is faster effect, this is important faster effect by the lungs, and I have already explained one point. We will see this the last in case of nicotine. So this is the important parameter. Second point, say volatile liquid and gas are given by this route. Can you give the solid via nasal route of drug administration? Can we give solid doses form like tablet capsule via the inhalation route of drug administration? No, that is not possible. In some case it is not possible, but in most of the cases, in general cases, the liquid which are volatile can be given through this route, and the gases or obviously can be given by this route. Liquid, but does not mean completely liquid. That liquid should be property of volatile. Like you have castor oil, you have peanut oil, you have olive oil. Can you smell that olive oil, castor oil or peanut oil? That will give you fragrance? No, that is not possible. If you leave that oil as such in the room, will be they evaporated? No, they will not. So this kind of liquid is not possible. So which type of liquid can be given through this inhalation and nasal route of drug administration? Only those liquid which are volatile in nature, like this eucalyptus oil and other oils. These oil are essential oil or volatile oil. So if we leave this in the room, they may be get evaporated. If you smell this, you will feel a different kind of smelling activity that will relieve the congestion inside your nostril. So this is used as a drug. It is it can be used in many forms, directly with the help of cotton soaked, and you can also apply it in a nebulizer and different vaporizer. This is vaporizer. So if I want to get relief from the nasal decongestion, I should warm this water so that the vapor will be released, and in a small buds of cotton I have to apply, or I have to soak this eucalyptus oil or nilgiri oil in that the pot, so that the vapor which is coming out from the pot can inhale like this. So this will relieve from the nasal decongestion, and this is a vaporizer. Nowadays it is very utilizing in case of coronavirus pandemic situation. So this is important route of drug administration like nasal and inhalation, that will be give you benefit. What are the basic difference between nasal and inhalation? In case of nasal route, I have explained you like Vicks inhaler, you have to apply the drug inside your nostril like nasal decongestion spray. I will show you this. So first of all, let's see that video only, then we will continue that. So that video was example for the nasal decongestant spray. That drug was given through the nostril nasal cavity. But in case of inhalation, we have to give asthmatic pump that will taken from the mouth. But I do not have that model to show you in this lecture. But this is given by oral, that is not exactly oral, that is not going through the stomach, that give through oral, that have to be inhaled, that will go to the lungs only. That is the basic difference. So coming to the next one, that absorption take place from the lungs, number of alveoli are already present there. So as I have shown you with the help of sponge, there are so many alveoli, tiny air sac that will absorb your drug in the form of either air, or that means gases, or volatile oil, or sometimes that can also be given as a solid, as a droplet. I will see you later. So coming to the example, these are very important example that should be remembered in case of different types of objective type questions. So general anesthetic are given through this nasal route or inhalation route, most of the case with the help of oxygen mask. So what is general anesthetic? What are the different types of general anesthetic? We have already finished all these lectures of general anesthetic, local anesthetic in our main channel, that is Solution Pharmacy. So if you want to grasp all the detailed knowledge of this anesthetic, please go through that channel, and the link of that channel is given in the description box. So let me explain you in very short. General anesthetic is made of two words. The first one is general and the another one is anesthetic. So first of all, we have to get the meaning of this anesthetic. What is anesthetic? Anesthetic is any agent which are used to get blockage of pain, that is will be a completely reversible process, so that we cannot feel any pain while doing different types of anesthetic process like surgery. And surgery may be due to type minor and major. So we are talking about general. So those anesthetic which are used to completely block the sensation of pain throughout your body, that means complete part of body, not restricted to any single part or specific part. So that is called general anesthetic. And to give general anesthetic, we have different route of drug administration, even with different types of drug too. But in case of maintenance in anesthesia, we have to give that drug via inhalational route. That will be either gases like nitric oxide along with different types of chloroform, etc. So that will be given via this route of drug administration, so that will produce faster effect, and their elimination is also possible, that will be under control of yourself. So this is major advantage of this route of drug administration. Now next point says drug can be administered as a solid particle like droplet, or absorbed as a fine droplet as in case of aerosol. It is very fine and is very usable with the case of gases and volatile liquid. But in some cases, the solid can also be dispersed with the help of droplets, and that can be introduced via the aerosol. Like generally we use aerosol. So this is another example for the route of drug administration that relate with is inhalation route of drug administration. Now let's talk about basic example of this solid particle. The example says salbutamol. This is one of the most important drug under this category, and the salbutamol is used as an anti-asthmatic drug. In case of asthma, I will say again that I have already completed asthma in main channel Solution Pharmacy. So asthma is a condition where the airway get blocked. There is excessive secretion of mucus, so that will trap your mucus and that will trap your airflow. So there is causing of bronchospasm, that means constriction of bronchia. So to get relief from that condition and to allow the air to pass easily and comfortably, we have to use those drugs which will dilate the bronchia. That's called bronchodilator. So this salbutamol is an example of under that category, and that can be given through the form of droplet in aerosol. The next one is their basic advantage. basic advantage of inhalation and nasal route of drug admission. I have combined both of them. Let me explain you one more thing. I have few example like this. This is ethylene. Have you has studied about the asthma? So this is ethylene. This is called rectal. So in case of different types of asthmatic condition, to get relief from the congestion and bronchospasm, we have to use ethylene in case of nebulizer. You have heard about this word nebulizer that come under the inhalation route. So if we have to tear one rectals and pour this liquid into a cavity, from there that will come through the air or vapor and that will reach to the lungs. That will give you a local effect too. So this is ethylene that can be used in case of asthma patient, and that is some nasal decongestant. You have to just small capsule these are. You have to just cut this capsule, pour this liquid into a hanky or any cloth, then you have to smell it like this. So that will be a relief from nasal congestion. So this all example I have shown you are comes under the inhalation as well as in case of nasal route of drug admission. So let's see the advantage. The first advantage say almost immediate response. That is almost, not 100% I can say. The almost immediate response means whenever I am taking any drug via inhalation route, that will produce very faster effect as compared to the oral and other route of drug admission except IV. So in this case, this is very important. If your patient condition is very serious, the patient is very serious in case of asthmatic attack, in case of different types of activity, that drug may be desirable or may be abusable drug. Doesn't matter, but we are talking about the route of drug administration. That is why smoking can give you faster effect. That is why the salbutamol or any asthmatic pump give you faster effect. This is major advantage of this route. Now coming to the second one, in pulmonary disease, it serves as a local effect. Another important point. Suppose if any person is having different kinds of disease or disorder of respectively pulmonary or lungs, so it is better to give that drug directly to that particular affected part so that the relief may be get faster. This is the important advantage of this route of drug admission. Likewise, I have explained you in case of tuberculosis. There are so many research are going on. In that research we are trying, that means scientists are trying to develop a such kind of route of drug admission that will deliver the particular drug directly to the affected part. Unlike the other oral route of drug administration, it will take some time. So that will be beneficial if we can deliver that drug directly to the lungs where different kinds of microorganisms like Mycobacterium tuberculosis are getting developed. So that will be very beneficial for that condition and for that patient too. Now next one is no first pass, as it is like other one. If any drug is given apart from the oral route of drug administration, that will not go for the first pass metabolism and that will not degraded by gastric acid. That means first pass metabolism and degradation by HCl is only applicable with the oral route of drug administration. So you can write this point in every route of drug administration except oral route, so that no first pass metabolism. The drug will not go to the liver firstly, then after that will go after distribution, that will be go for the liver. But in initial case, that will not be degraded by first pass metabolism and that is not going through the gastrointestinal tract, so that why it will not be degraded or spoiled by gastric acid, which is secreted inside the stomach by different kinds of cells. So this is very important. So HCl will not affect this kind of drug via this route of drug admission. Now next point, elimination control. The control of elimination is in your hand. What is the meaning of that? Suppose I am giving someone a inhalation route like this. This is nasal, but let me assume this is inhalation. So if I am giving any person any route, any drug via this route of admission, if you want to get eliminate, what have to you do is just take it out. So you can control their elimination. But in case of intravenous, how will you control? You have injected any drug via IV, IM, SC, then how will you remove that? Do you have any option to remove that? There is only one option, that is next to impossible, that you have to filter all the blood. Is it possible? No. You can remove it as such, remove it? No, not possible. And in case of this, if you thought that excess amount of drug has been administered, then what you have to do? Not to worry. You can either remove it or just give the partial pressure of oxygen, fresh oxygen mask, so that that will replace that old one. The drug from the lung can be replaced as such as because of inhalation and exhalation principle. Next one, their limitation. They are basic limitation actually. So first limitation say irritant gas. There are few gases which are irritative in nature. So if we give that drug, that irritative drug via this inhalation route of drug administration, they may cause increase in the mucus secretion. And what will happen after increasing of mucus secretion? See, this problem has been, that means anti-asthmatic problem, this means that asthmatic problem was treated by salbutamol. So anti-asthmatic condition is very important for us. Asthma, no. Anti-asthmatic condition is very important, but in case of this, while secretion of mucus is getting increased, that will create a lot of problem. So mucus will be secreted faster, more in quantity, then you will have problem in breathing and other difficulty. So that is limitation with only those drugs which are irritant in nature. That is not applicable for the normal and usual drug. Now next disadvantage or limitations say large particles introduce cough. If you are giving any drug via this dispensing method, via aerosol, via droplet form, that large particle may irritate and may cause coughing. So like you will feel this type of activity. Example of this category are chromylene sodium, which is example of mast cell stabilizer. Now you should know what is the meaning of mast cell stabilizer. Any drug which is stabilizing your mast cell is simply considered as a mast cell stabilizer. Now again question arises, what is mast cell? These are responsible for the allergic response that release histamine. We will see it later on, but these are drugs which stabilize that release of histamine from mast cell, so that you will not face any allergic response. This is antihistaminic drug. So last, but this is not exactly related with this route, but this is applicable, so you should understand this point also. The route of drug administration like inhalation and nasal are major route to be abused by some kind of drug. As I have shown you starting, and I have explained you also, there are good chances of drug administration via this route of drug administration, but every coin has two aspects. If there are some positive feedback, the positive advantage, positive response, there may be some misuse too. So any drug which is intended to be absorbed faster, that is therapeutic drug, can be given by this route of drug administration. By utilizing that advantage, some people can misuse this route of drug administration too. Like in case of smoking. The smoking means in cigarette there are leaves of nicotine, that is volatile in nature. Volatile oil actually nicotine. So whenever they smoke with the help of flame, that nicotine convert into vapor form. That vapor form reach to the lungs directly, and they will produce faster effect. Either it will give you serious effect or some kind of uncomfortable feeling if you are taking it first time. So this effect is faster. Like smoking and some case of drugs, you have seen in so many videos nowadays that if person want to take drugs, that are drugs, not medicines, that are abusable drug, I would say. So those drugs are taken by this nasal route of drug administration, and that should not be taken place. Thus I am giving the example. So this is a limitation of this route of drug administration because of few people only. Just because of this anti-social person, this route of drug administration has been converted as a most favorable abusable route of drug administration. So friend, these were some basic points regarding inhalation along with the nasal route of drug administration. We have seen their advantage and their limitation. So that's all for the day. Thank you very much for watching this video. You may have a screenshot of this whiteboard section. After some time I will bring it aside from this whiteboard section, then you can take the screenshot of this section. So at the last, I would like to request you to please give me feedback, because this is my first opportunity to deliver lecture in English language, because my preferred language was Hindi, but just because of your request, because request from many students, I have tried to deliver it in English. So there may be some problem, grammatic problem can also be available in this video. So I would like to get your suggestion. Thank you very much for watching this video, and take care. Thank you.